Hi, good morning, everyone. It is Brad Petrella. I am solo today. Jeff is on the road. He's listening in because he can't miss another great presentation by Shondell from Ambetter. Um, why do I want to do this? Hang on. Oops, let me stop sharing. Let me share. Okay. Now we're where we want to be. Again, Ambetter individual products with Shondell. So, housekeeping, as many of you know, use the question box to type in any questions that you have. And since I'm going solo, we're probably going to wait until the end to get to them. So just be patient to get your answers. We can always go back if we need to. What's next? The Broker Expo. Hopefully, you've all heard about it and have registered. For those of you in Northeast Ohio or Northwest Ohio, all the way down to Lima is probably a drivable distance. Um, I will get your phones ready. I've got a QR code coming up next if you haven't. For those of you in Cincinnati and Central Ohio, don't worry. We're going to be in your area next year. It's just hard to do all four at one time. So, who do we have in Northeast Ohio? We've got Wendy Beatty, who actually used to work here at Cornerstone. She is going to be doing a presentation on artificial intelligence for agents for marketing purposes. And then over in Northwest Ohio, we have our very own Lael Reitler, who is going to be doing a 101 about ICRA, because that's what's the hot topic in the industry right now. So, ready? Here's the QR code that you're going to want. So, I tested this. So, if you grab your phone, you scan that QR code, it will work. I don't want you to miss it. We are in Northeast Ohio, approaching 100. In Northwest Ohio, we are very close to 50. So everybody's jumping on. So I don't want you to miss it. We have all ACA carriers will be here. Several other vendors, all the under 65, like ancillary supplemental carriers will be there as well. So you're not going to want to miss it. It's an action-packed day. Foods included, drinks are included, not soft drinks, not alcoholic beverages. But anyway, that's my pitch on the expo. Don't miss it. I've been working hard on it since about November. So yeah, that's it. I think, Shondell, I'm going to turn it over to you. Let me stop sharing. There we go.
You
I
see
see
that?
you. Yep,
Okay,
all good.
perfect, perfect. All right,
Let's
so I
get the
appreciate
hi
it,
button
Brad.
real quick.
Thank.
Hit-
I'm good to go.
Yeah, see that pop up that says stop sharing or hide? Just hide it for right now. There you go. Okay, fire away. I'm going to go on mute. Take it away.
Okay, thanks, Brad. Anything out the ordinary, let me know or stop me or whatever from anything I'm doing throughout the presentation. But hey, Grand Rising, everyone. It's a wonderful Grand Rising, ain't it? It's supposed to be all sunny and hot around this time. But hey, I'm out of Chicago. As Brad said, I'm Shondell Coleman. Represent our Midwest region. I do appreciate everyone just hopping on this call. This early. Cornerstone is great. Brad is great. Did a lot of work to put this together and give us the opportunity to represent Ambetter, as their carrier. So got some information here. I would love to just share with you all and look forward to the presentation. Later on too. So some of this is a refresher to some brokers, right? But I do want to reiterate that our footprint. So we tend to expand in different states. This year for the new state, we enter into Iowa. If that's a state that you're interested in or licensed in, be sure to reach out to me. I'll be happy to get you contracted there with Cornerstone. Also, Ambetter Health has exited New Mexico. That was as of December 31st of last year. Okay, some updates here. So, as you know, Gold, Silver, Bronze Network, which used to be called Core, is now the Premier Network. So you'll see that, currently out there, starting in the new year. We also rolled out the Ambetter mobile app. that we launched back in July that members can download from their phones. The broker portal, we enhanced it quite a bit to include renewal letters for the brokers out there, and also the auto pay option. We expanded into Iowa, our new state. We also have some specific diabetic condition plans, but they're only available in quite different states. So we got Florida, Georgia, North Carolina, New Jersey, and Tennessee only. Plans no longer offer in the state of New Mexico because that is discontinued. And then we have our virtual access plans, which have been discontinued. So what's new for this year? So we're Premier now. We got the new mobile app. We got the renewal letters. We have expansion in the state of Ohio. That's Hocking and Morgan counties. And then we have our new off exchange plans that we introduced, which is called Ambetter Health Solutions, which we'll talk about later on a bit. So, in the state of Ohio, we only expanded to two counties. There is Hocking and there is Morgan. No update as of now. It's still a little bit early, but we'll be sure to share that communication with you all if there's any expansions. So, we want to tell you all, hey, why sell Ambetter, right? So one piece of this is the network. Here is just a partial provided list. This is not the whole entire list, just a partial list of some top key providers that we have. You can, leverage other sites out there like, Marketplace Health Sherpa, or there's the Ambetter Find a Provider tool as well. You can feel free to search any additional providers there too. Okay, some highlights from our Premier portfolio plans. For these Premier, this is our broadest provider network. It's available in all of our counties. With this, members can visit any in-network provider with no referrals being needed. When you're also searching the provider guide, you will want to choose the Premier network versus the core. And then our adult vision and dental buy-ups are also available on many of our plans out there. Okay, so we're gonna dive in some of the products, all right? Some of the plans, what those look like out of the state of Ohio. So we have our bronze, silver, gold. Okay, on the bronze, we got the choice bronze HSA, we got the everyday bronze, and we have the standard expanded bronze. Under silver, we got the clear, complete, and standard silver, and then the gold, we have the clear, complete, and standard gold. All right, so some key plans that I just want to focus on because these are some tend to be some of the richer plans out there in particular. So for one, we have the Choice Bronze HSA. This is an HSA eligible bronze plan. Not going to touch base on each point, but you get it by just by looking. But with this, you will see that the deductible is $72.50 as well as the out of pocket matching. We have a 0% co-insurance on this plan. For telehealth as well as the visits and labs and RX, these are all 0% after the deductible. So a key thing to keep in mind. Clear Silver. So this particular plan has a matching deductible and maxing out of pocket. It does have a $0 prescription at the deductible. This particular plan does not include vision or dental though. So starting at the base for Clear Silver, it does have a 6,500, and it does goes as low as $800 on a 94% actuary value. Max out of pocket is the same. And then the co-insurance is 0% across the board. We do have virtual 24/7 care, which is no charges. And then you can see under the preferred generics and RX, there is a 0% at the deductible is hit, as well as the preferred RX drugs. All right, this complete silver. This complete silver plan has a $0 deductible at the 87% and 94% actuary value. It does include the PCP visits at $0 as our labs and generic prescriptions. So if you look here, deductible go as high as the base at 6,000, low as $0. Teledoc, we got the no charge across the board here. And then our preferred generics going as low as $0, and then as well as our urgent care going as low as $10. So just looking at the actual value and seeing where the client stands, this will definitely give you a better outlook of where the member will be paying out of expenses and so. All right, our plan offerings. This is just a comparison, right? So we have a silver comparison at the 94%. Okay, so the clear silver versus the complete silver. So clear silver has an $800 deductible. Complete silver is $0. Max out of pocket. Co-insurance difference. No charges for both. If you look at the visits here, lowest especially the specialist visits $25 on the clear silver. And then for the urgent care, we got $5 and $10 on the complete silver. So just a little bit comparison. This is some of our richer plans. So just to give you an idea, a bit of the differences, vice versa, what these looks like. All right, moving on to the standard silver. This plan is a $0 deductible. It has a $0 PCP visits. Okay, we got a base at 5,000. It goes as low as $0. Max out of pocket as low as 2,000. Okay, virtual care do have a $40 at the base, but it is a $0 under the 94%. We got specialist visits going as low as $10. And then under RX urgent care, we are going as low as $5 on the standard silver plan. Clear gold. So we got that gold plan. This is our lowest lower cost premium gold plan. It does have a copay and generic prescriptions along with the urgent care. We got a $900 deductible, $8,400 max out of pocket. We got $25 copay for the PCP visits, right? Labs are 30% after deductible is met, and then urgent care is $60, $0 respectfully on the copay on this plan. Okay, moving forward. So all of our members, just let everyone know, they do have services through virtual for our teledoc health, which are 24/7. We all understand, the location around members. This is a way to cut that in half to give members a better experiences and connect with these experts, right? And get easy, fast access. I know I hate waiting the long wait times like myself. So this is a great benefit for our members out there that need an urgent need. Okay, so our adult vision, what does that look like on our adult vision plans? There is no waiting period. Okay, you will see on our plan, you can on our exams and eyewear, you get a routine eye exam, one visit, $0 copay. We do cover up to $130 on the frames. Under the eyeglasses lenses, we do cover up to 100%. And then just members have to be 19 years of age or older. Something to keep in mind. We only cover in-network providers only. And just a note to keep in mind, the network we use for adult vision and dental, at that is Centene. Just FYI, I know for vision or so it used to be called Involve, but it's been changed to Centene for both. So just something to keep in mind. Transition on to the adult dental. So this also has no waiting period. Under our class one, there's a $0 copay for the routines and X-rays. Under the class two, for the minor work, we have 50% co-insurance. And then as you get more into the major dental work, class three is 50% co-insurance as well. So we do cover up to 1,000 calendar year. Members does have to be 19 years of age and older for this. There is no coverage for out-of-network providers. All right, we're moving in hot. So we have introduced the new off exchange plans this year called Ambetter Health Solutions. Okay, so this is an alternative way for those who do not qualify for subsidies. Good for those off exchange. This does have a large network. Okay, you get the same reciprocity with crossing state lines with what you get for on exchange. Same benefit, same network, same thing. So members can enroll into the Ambetter Health Solutions. Okay, this only accepts states like California and New York. You may have heard things out there like Health Net, for example, that does not tie in with that. So our off exchange plans runs the same as on exchange as well as network. Something to keep in mind too, if you are looking to enroll members off exchange, you can go through our enrollment platform. Go through enroll.ambetterhealth.com. Save that URL, or for the future if you want. I know there's other platforms out there, Health Sherpa, but this is there for you too. So our Ambetter Health Solutions only offer it in these states. You got Georgia, Indiana, Ohio, Missouri, Mississippi, and South Carolina. As of today, not have not got any information on what expanded states yet, but I have heard there may be some other states out there. So stay tuned for that. Okay, so this is our off exchange product offerings for off exchange. So for Ohio and Better Health Solutions portfolio, we have our bronze, silver, gold. Under bronze, we have our and Better Health Solutions bronze 1800, 5000, 7000, and then there's the HSA 6400. Under the silver, we got the 1350, 3000, 4500. We got a HSA 4000, and then there's the copay HSA 4000, and there's a 5000. And then for the gold, we got the 1500, and then you see the rest. They don't have to go through everyone, but that's our portfolio for the Ambetter Health Solutions. So I'm just going to dive in just a little bit into the plans of what these look like for Ambetter Health Solutions off exchange. So the 1800, this is tailored to plan copays. $1,800 deductible, $1,900 max out of pocket. Okay, and then the urgent care at $100 on this plan. All right, this is the silver 1350 with the deductible. Max out of pocket 8600 with a 50% co-insurance. We love that $0, so we got virtual care $0. And then for urgent care below, we have $0. I mean $60. Sorry, $60. Okay, this is the gold 1500 deductible, 16,000 max out of pocket, 20% co-insurance on this plan. There's a 20% out the deductible for the labs, and then the urgent care on this plan is $20. Okay, so I understand that we have some agents out there that sell in multiple states, right? Not just Ohio. So I'm just touching bases on another state here, which is Kentucky. So Kentucky is the same. We move on to the Premier Network. We launched the app, renewal letters, such, and then we also offered our off exchange plans in the state of Kentucky. There is no expansion in the state of Kentucky, so we're still solid there. Some of the highlights for Kentucky. This is just a partial list of some of the providers that we do have. Again, just a partial list, just to show some of our key partners in the area that we do have in network. And feel free to leverage the providers who, etc., for other providers. Kentucky portfolio, we have the bronze, silver, gold. There's the choice in every day, the silver, clear, complete, and focus, and then gold, the complete and everyday. Okay, everyday bronze. This particular plan have a $0 virtual care. There's a 8,450 deductible, and then there's a $9,200 max out of pocket. Urgent care is $50 on this plan. Focus Silver. So this plan on the Focus Silver goes as low as $0 on a 94% actuary value. Low is 1350. We have 30% co-insurance going as low, and then $0 across the board. And then for this particular plan, our urgent care start at 60 and go as low as $10 respectfully on Focus Silver. Everyday Gold. This is a $750 deductible plan with a 7,000 max out of pocket, 35% co-insurance. Labs are $35, and then our urgent care on this plan is $35. Okay, transition on Indiana. Indiana's a state I just want to touch really fast on. Same information, what we launched, what's new. We introduced the Ambetter Health Solutions. Keep in mind we used the Ambetter Health National brand and discontinued the Ambetter from MHS branding. So just in case what you see out there, okay. Statewide, we're still statewide in Indiana, not going anywhere. So, some top reasons to sell in Indiana. So, these are some of our key partners, partial list, and some of the areas that we do have, some of the providers that we have in network. Okay, so this is our Indiana HMO portfolio. We have the bronze with the choice everyday standard, clear focus standard for silver, and complete elite and standard for gold. Okay, this plan, standard expanded bronze, has a $7,500 deductible, $9,200 max out of pocket with a 50% co-insurance. It does have $50 copay for virtual care as well as the visits. And then this plan has a $75 copay for urgent care. Everyday bronze. This particular plan has $8,450 for deductible, $9,200 for max out of pocket, 50% co-insurance. But this plan does have $0 for virtual care, $40 for visits, and this plan has a $50 for urgent care. Everyday bronze. Focus Silver. So one of our rich plans, this is $0 deductible on the 94% actuary value. Max out of pocket goes as low as 1350 and 30% for co-insurance. $0 across the board for urgent virtual care. And then this plan too goes as low as $10 respectfully on our urgent care. So I know it's a bit of quiet information, but these are some of our rich plans and what you see out there. I think is good to know, and some of the key points here based on the members level. Standard silver, this goes as low as $0 deductible, as well as the PCP visits at the 94% actuary value, and it goes as low as $5. Then I think this last one, but the standard gold, this is a $1,500 deductible, 7,800 max out of pocket with 25% co-insurance. It does include $30 copay for virtual and PCP visits, and then this urgent care on this plan is $45. Complete code. This plan has a more lower cost premium gold plan. The co-insurance 20%, virtual care $0, and urgent care is $35 on this plan. Okay, just something to pay attention to our Ambetter Health Solutions PPO and EPO portfolio. Just gonna let you just look at it, so I don't have to go through each one. But our bronze, silver, gold broken down for off exchange. Okay, this is the bronze 7,000. We got the 8,500 max out of pocket, and then this plan has a $55 urgent care. This is the silver 5,000, 5,000 deductible with 7,750 max out of pocket. Urgent care on this plan is $40. 3,000 deductible. This has a 5,000 max out of pocket. $0 virtual care, and then we have $50 for urgent care on this plan. All right, this is important. I know we went through the plans, but this is important here. Everyone should have access to your broker and better broker portal. Please take time to just log in, look around. This is some great information you will find in your portal that you don't have to reach out to us about or me. So anything around plans, we have coverage maps in there. We have benefit programs in there. And stuff around the off exchange plans and the network. That's also in there too under training materials. So literally, once you in your broker portal, you can go to resources, and then you will see training materials. Under general health, you'll find more information, benefit stuff, marketing stuff. There's some information around state specific. So if you sell in multiple states, so yeah, again, take time to look into your portal. Look at those training materials out there. If you got any additional questions, please feel free to reach out. But there's a lot of great information in there that you will find in your portal. Okay. If you need assistance logging in too, feel free to reach out to us. Okay. This is what I mentioned too, right? The Ambetter Health Solutions are new off exchange plans, right? So you will see this when you're searching in our provider. You will see the network. So you'll see either, Premier. We'll get into it later. But pay attention to the network. So, in the state of Ohio and the other states I went through, it's only Premier. And then there's also solutions in certain states. But if you see other network, let's say you see Select, you see Value, that's when you get more into those bigger states, right? You got Georgia, Texas, Florida. Those states does have a bit more slimmer network. They do have Premier and network compared to Ohio, but I just want to let you know the network is different. They have different networks, so you just have to select the right one. Something to keep in mind. Okay. Okay. So I do want to let you all know how to find the formulary here. So just go to ambetterhealth.com. You're going to go to make sure you select the correct state that's specific to it, and you're going to click on drug coverage. It's quite a big file, so what I advise you to do is hit Control F and then go ahead and input the medication there. If it's not coming up, most 9 times out of 10, it's not covered. I will also reference the EOC or evidence of coverage too. In case you do need to make exceptions, you can reach out to our member services team. You will have to go through that process with them on anything being covered. Also, if something not covered too, you may find a generic drug, something that's similar to that, right? And it may be covered on a different tier or something. So just something to keep in mind as well. All right, this is free money. I like to call this free money. This is our Ambetter, the biggest benefit program out there. It's called My Health Pays. This is where members can earn up to $500. Yes, I said it, 500 free money, and they can reduce their premium. So if I have a high premium, I can reduce that by $41, no problem. So this is a breakdown, a schedule, what it looks like. You can find this also in your broker portal. Keep in mind that members must be 18 years of age or older, and they have to complete the online well-being survey. So basically, they do these activities, which converts into dollars, which converts into free money. So these are some of the things the member can use to pay for. So, rather than health-related costs, they can use it to pay monthly bills, which we all have. There are some great merchandises, and they get this nice raspberry color too, card that they can use. So uh, I was, there'll be a great benefit to let members know. This here is a discount program we got. So members that are very highly into, losing weight, into their health, fitness, you can go through Benity.com. Okay. So make sure when you go through Benity, there's a discount code that you put in there. It's called Member Perks. Member Perks. That's one word and it's all together. Member and then Perks, Perks with an S. You can put that there. But this is a good benefit too to let members know about. Before I get into this too, I do want to let everyone know, and I can go back if need be, for the presentation coming up here, we will be speaking a lot on ICRA. ICRA is becoming really, really big here. And we do have a team, a ICRA team on our end. So, we're happy to answer any questions that any broker may have. We do have a representative. His name is Tony. That he does support our team for ICRA. I mean, you do want to just keep in mind, right, that these businesses that you do work with, they have to have a administrator set up. They have to. Any benefit administrator system, that they can leverage and use to, put their members on ICRA. So, what we have and what I would say for all brokers is that and better health solutions that I talked about, right? That will be a great way to just enroll members through there. It's not just for ICRA, right? It's for any member, any member. It's for off exchange, all that. So that's why Ambetter Health Solutions is there. It's there to give members like ICRA, opportunity to get on Ambetter plans and use their benefit and also leverage the network. So if we're talking about network, like these members can cross state lines. As of today for ICRA, members can cross state lines. They can be in Ohio. Oh, I gotta go to Florida. Can cross state lines. So I think that's a really key thing too. And at the presentation coming up, we will be there. We will talk a little bit more around ICRA. We will have a representative as well to talk on that as well. But just want to point that out that we are doing a lot around ICRA. We are wanting brokers to enroll as many members as they can through our platform and use Ambetter Health Solutions. But yeah, get enough of that. Contact information is here, as you've seen while I was talking. In case you want to know, hey, who do I reach out to for these kind of issues? So I have broker sales support. That's our sales support team. We help with member increase, commissions. They also web support, providers, and contracting. So they're 5-855-700-7985, option 2. And then our email, ambetterbrokers@centene.com. And then broker sales, that's where I'm at. We help with appointing, contracting, education, anything around products and trainings, marketing. If you ever need some Ambetter swag, I like to call it. We have brokers that do events, right? So if you need some materials, let me know. I'm happy to send you some stuff. We got stress balls, pens, and a lot of other great things. And then we have the same number, but our email is ambettersales@ambetterhealth.com. Any questions, feel free to let me know. I'm here to support you all the way. Cornerstone is a great partner. I love them. We're winning together, and I know that with the upcoming changes we have with the CMS, who knows what's going to happen, but together we're hoping that we can continue to service members out there. So if you need, let me know my information. I'm looking forward to work with y'all and seeing you all at the presentation.
Very good. Thanks, Shondell. Great as
Yeah,
always.
absolutely.
And
Let me know if I have any
everyone,
questions too.
yeah. I wrote down a couple that we wanted to do. Let me stop sharing. And I was actually asked a couple at the same time. But yeah, Shondell, I'm going to be glad to have you and the team at both locations for the expo. So I really love the call out on the networks in other states. But Shondell, how will a broker know which network to use there? So if they select the state, does it automatically select, or does it automatically
Got it.
select the network for that state?
Yeah. Good question, Brad. So, if you are appointed in multiple states, right, and you go on Ambetter, find a provider tool, the link actually, I don't think it was in the presentation, but it's guide.ambetterhealth.com. That's our find a provider tool, guide.ambetterhealth.com. So, when you're searching for network provider, it's going to ask you, right, like, what's the network? So it's either going to be Premier, but it's depend on the state, right? So in the state of Ohio, right, we only have Premier in Ohio. States like Florida, Georgia, they do have Premier, but they also have Select. They also have Value. Select is more selective, more slimmer network compared to a Premier. I always recommend going the Premier route, because you get the bigger bang for your buck. Premier, you can cross state lines. Same with Ambetter Health Solutions. You're going to see that too. So when you're in a provider guide, you're going to want to make sure you select that. And let me know, Brad, if I need to show anything real fast. But it's going to direct you on which network you want to select. So you have to
Right.
make sure you select the right one,
Right.
depending on that state. But
Right.
Ohio, you don't have to worry about, since it's already
Right.
Premier out there.
What about Shondell? Like, say in Florida, where they have three networks, do
Yeah.
are all three available in some cases in a county, or are they more done regionally?
It's
You
it's it's done regionally throughout the
know?
whole the state. Yeah,
Okay.
it's just
Okay.
like that. So it's more state specific. And again, you just got to make sure you select the right network, and it's going to tell you too, like which network,
Okay.
and then you
Okay.
got to make sure you select the right one. But yeah,
Got it. Just like somebody in Pinellas, they're not going to have a choice of all three. It's going to be one or the other. So that's good to know.
Right.
Okay,
Yeah.
good.
Hmm.
This is a great question. The rewards program, which is amazing, is it also available to off exchange members just the same as Onyx?
Oh, that is a good question. Yes, it
Yeah,
is. Yes, it is. It is on and off exchange.
nice.
It doesn't matter. ICRA, whoever come on board to Ambetter, they have that option to do my health pays. Just like I
Okay,
said, they have to be 19 years age or older, at
right.
least.
Okay,
Mhm.
okay. That's good. That's good. And Shondell, thanks for offering our brokers. If they need swag for an event, just contact Shondell. He gave you his number, or I can
Mhm.
connect with him if you don't have him. Um, so yeah, that's what to do. Gang, the heavens are going to start opening up here in Avon, and I'm worried I'm going to lose power. So,
Yeah, yeah. It's over here
if
too.
you've got if you've got a questions, okay, Lenny, let me ask you: are the perks, Shondell, in every member in a family, are they eligible for up to $500, or is it just for the primary member?
It's going to be for each member. Each
So
member.
long as they're over 19, they get it. So
Correct.
children
Correct.
aren't going to get it. Okay,
Yep.
good, great question. John, yeah, let's talk and we'll take care of that today. Just, yeah, give me a buzz. Great. Anybody else? Going once, going twice. I'm going to stay on here for a minute. I don't want to lose everybody or lose power. So I'm waiting a minute, give people a chance to type. If you want to, if you're not coming to the expo, please let me know what your excuse is for fun while we're waiting. I don't think you're going to want to miss it. Last year was a massive success. All the brokers who attended were glad that they did, and all of the carriers that exhibited were glad that they did. So we have a couple of carriers that weren't here last year. They don't want to miss it, so they're going to be here. So we're going to have a full suite, all 9 of our carriers, plus one that we don't have but may soon have as a GA. You already all know it. We had it before. So yeah, so I'm not seeing any more questions roll in. So I am just going to call it. It was a nice, short, sweet 40-minute presentation. So Shondell, thank you. The slide deck,
Absolutely.
Shondell is going to share the slide deck with me, and when you get the follow-up email with the recording, we'll attach or there'll be a link that you can download a copy of the presentation. Okay. So I think
Thanks,
that
Shondell.
covers everything.
Hey, hey, hey.
Hey, say hi, everybody, to
It,
Jeff.
Hi, everybody. I-75. It's raining cats and dogs up here. Weather is coming in, man.
Oh
Great
man.
job, Shondell.
Thanks, Jeff.
Yeah,
Everybody sell and
Drive
better.
safe
And
out there,
better.
man.
yeah. All right, Jeff, just be careful. We don't want any of our other carriers to be on here listening and think we're
Right.
showing favoritism. But Ambetter is our number one choice carrier by so.
Oh,
Um, anyway, just keep it going. Have a great rest of the week. Stay dry. It's going to be hard to, I think, in Ohio between now and Sunday. And just stay safe. I know there's flooding possibilities, so just stay safe wherever you are. And we will catch you on a training. There's actually going to be another one next Wednesday for a carrier that we have not previewed yet. And you want to join it. It's about Life Secure. They offer indemnity plans, so it's a nice alternative option. And if you're selling group, they offer long-term care for groups as an offering. So yeah, you're right, Amy. There are a couple others on here who have specifically sold Ambetter for off exchange to groups for ICRA. So yeah, the Premier Network is something that no other carrier has because there are no PPO plans in Ohio. So it is the next best thing for all of those snowbirds that we have in Ohio to go to Florida, Arizona, South Carolina, North Carolina, wherever they go, that's warmer and less gray than here. It's perfect for them. So good call out, Amy. Thank you. All right, I think that is it, everybody. Again, stay safe. Have a good rest of your day, good rest of your week. Take care. Bye now. Bye, Shondell. Thanks again.
All right, take care.
Thanks,
Yeah, John.
guys.
All right, see ya. Bye.